I'm Dr. Becky Spelman. I'm a registered psychologist. I treat a lot of clients with depression. It is one of the most common difficulties that people come to see me about. When people are depressed, they're often quite confused about what's causing it. They sometimes think that they might need medication. And actually, most people don't need medication at all for depression because it's often not about a chemical imbalance. Most people can get better by themselves with a little bit of help of a few different strategies and tweaking around some life balance stuff. And also some of the stuff on the cognitive side can be helpful. So cognitive behavioral therapy is one of the most evidence-based treatments for depression. And the reason for that is that often depression is a reaction to a negative life event that you've experienced, or you have become stuck in a mode where you don't have the healthiest balance in your life. So you don't have things in your life or the balance in your life that would create happiness. And by using techniques that are on the behavioral side and also on the cognitive side, we start to break the cycle that's maintaining your depression. So when I speak to someone who has got depression, I ask them a lot of questions about their lifestyle. For example, are they enjoying things in their life? Are they quite active? Are they getting things done? And do they feel close to other people? Are they enjoying time with other people and experiencing closeness to others? Often what I find about the depressed client is that their balance has gotten thrown off keel for whatever reason. Maybe they've gone through a breakup or a bereavement, or maybe they're just stuck in a bit of a rut where the right ingredients for happiness is not taking place. And we do actually need to work on happiness. It's not just something that arrives. It's something that we have to put time and effort into. Of course, for some people, they quite naturally do the right things that make them happy. But often, it's a typical human condition that we may have had something that has kind of started off the depressed mode for us, and then that can escalate. So for example, if someone is feeling a bit low and they start doing less, then that can cause a lot of unhelpful thinking. And then we start to have this kind of vicious cycle that feeds into the depressed mode. It is then very difficult for the person to start being active again. So to break out of the depressed mode is very, very difficult. It's challenging for people. And that's why when people come to see me who are depressed, I always start with the behavioral side of things. I just get them doing things again. As simple as it sounds, for the depressed client to start to be active again is a really difficult ask. So the first week of treatment, I look at that person's schedule. How have they been spending their time in the last while? And we try and shake things up a bit. We create a completely different schedule for them for 1 week, get them doing really different things, and they start engaging in life again. They start doing things that they enjoy, being more productive, and enjoying time with other people, essentially feeling that social closeness to others. Then we review things in a week's time and just check, has that influenced their mood? And after that, we can then engage in some of the cognitive side of things, because when people are depressed, they really take on a glass is half empty perspective. They start to see things in a very negative light. So then I will start to teach them how to challenge and change their thinking. Essentially, we're attacking the depression cycle so that people start getting a very different result. Because if someone's in a depressed mode, they're in a mode that's being maintained by the same kind of behaviors, the same kind of thoughts. It's a vicious cycle and it's hard to break out of. So there's a range of techniques on the behavioral side of things and on the cognitive side of things that can help people start to break out of depression in a relatively quick manner. And they start to lift their mood, they start to feel better in a short space of time. But it has to be quite collaborative. People have to have a good relationship with the therapist. They have to trust and like their therapist in order for this therapy to work. And they have to be committed to trying the techniques that the therapist recommends. And how do you know if your therapist is going to recommend the right techniques? Well, if someone is an accredited cognitive behavioral therapist, and in the UK, the association that they should be accredited with is the BABCP. If someone has reached that accreditation, then you're guaranteed that they have trained in the right approach that is most likely to create relief from depression, because cognitive behavioral therapy has the best evidence base. It's the therapy that has the most research that proves it can help people break out of depression. And it's better to try therapy before you try medication. And the reason for this is if you go straight to medication and you start to feel better, how do you know that your depression is really gone? And do you end up becoming quite reliant on the medication? Whereas if you learn strategies that you can do yourself, then you can feel quite empowered and you can know how to manage your mood for life, because it is a human condition and we're all affected by periods of sadness from time to time. So I would definitely suggest that people try cognitive behavioral therapy before going to medication. It's a question that I'm commonly asked. And I saw a client recently who had just been prescribed medication. They hadn't actually started the medication, but because they had mild to moderate depression, they said to me, "What do you think about this medication that I've been prescribed? Should I try it?" And I said, well, because you're able to get out of bed, you're still functioning, you're not severely depressed to a point of feeling suicidal. They were still going to work and they just felt a sense of very low mood, but still being somewhat active. I told them to hold off on the medication for just a few weeks until we got started the therapy. Straight away, they started to engage in the behaviors that I recommended, and they started learning the cognitive strategies to challenge and change their depressed thinking. And that client came back to me after a few weeks and said, "That advice that you gave me about the medication, I am so glad I didn't get started, because I'm feeling a lot better. I now know things I never knew before, and I know how to break this cycle. I feel in control of my mood, and I actually don't feel that the depression is taking control of me." They learned a lot through the treatment, and they certainly thanked me for not going on the medication. And that was a client who is no longer depressed. They broke free of it. It was a life situation that had caused them to be depressed, which we worked through and helped them re-engage with life again, become more active and spend time in a way that was very satisfying and felt very rewarding. And we really had to change their entire lifestyle and how they were spending their time in order to help them get better and no longer feel depressed. And if this is something that you're experiencing, if you feel depressed, then we can certainly give you a little bit of advice and guidance about this without you even having to start therapy. We can give you a free consultation over the phone, and you can talk about your situation, ask a few questions. We can certainly recommend something for you with no obligation to actually start therapy. We can just give a little bit of advice for you to go away and think about.